Hello, my name is Hannah Riga, and I am a third-year medical student from Kansas City University. I will be presenting mine and my co-author, Maxine Derrick's research on densities and Hounsfield units of foreign bodies based on their molecular composition. Overview. This study is important for the treating physician and the radiologist because foreign bodies can often go unidentified and unreported on imaging studies. We will be presenting on the Hounsfield units of 3 different foreign body materials, including metal, plastic, and cellulose, with supporting images. HU values range from -1,000, which is air, to +3,000, which is like density of bone, and these are used to differentiate between tissues and materials with varying radiodensities. Metal. Metal is highly radiodense, meaning it absorbs X-rays and appears white on medical imaging. HU values for metals are typically +1,000, making it easy to differentiate them from surrounding tissues. Metal implants, such as artificial joint replacements, can cause image artifacts on CT scans. This can make it difficult to interpret the image accurately. Here we present an image of a metal-forming body, a screwdriver, which is discernible only from a sagittal slide and is approximately the same radiodensity as the spine. Hounsfield units can confirm a diagnosis of a metal foreign body. Plastics. Plastics have lower radiodensity than metals, making them more difficult to differentiate from surrounding tissues. HU values for plastics are typically between -100 and +1,000, depending on the type of density of the plastic. Specialized CT imaging techniques, such as dual energy CT, can be used to improve the visualization of plastic materials. Here we have an example of a plastic foreign body which, upon axial CT imaging, is difficult to differentiate from surrounding tissues. Without a thorough patient history, it could be difficult to ascertain that there is a foreign body within the patient's pelvis in imaging. It is important to know that plastic foreign bodies have the same radiodensities as the surrounding tissues. So, the clinical physician can optimize a complete patient history and apply it to radiological studies. Hounsfield units should be used along with clinical evaluation to diagnose plastic foreign bodies. Cellulose. Cellulose is the main component of plant cell walls and is found in materials such as paper and wood. Cellulose has low radiodensity with HU values typically between -1,000 and 0. CT imaging can be used to detect defects and anomalies in cellulose-based materials, such as knots in wood. Here we have a CT scan of an apple, a cellulose foreign body, which is difficult to differentiate from surrounding tissue. In conclusion, Hounsfield units are a valuable tool to differentiate between materials with varying radiodensities. HU values can be used to detect and characterize a wide range of materials, from metals to plastics to cellulose. However, it is important to recognize the limitation of HU values and to use clinical evaluation and thorough physical exam to appropriately diagnose and treat the patient. Thank you so much for your attention, and have a nice day.